Assalamualaikum and hi everyone. My name is Syahida Binti Ahmad from BA2352B. I have chosen one topic to discuss from chapter 9, which is the health or social care practitioner-patient relationships. I have also added other references to this topic for learning purpose. So let's take a look together. So this is the list of topics that we are going to cover and discuss together. Okay, first, the practitioner-patient relationship. Health or social care relationship with the practitioner are central to the practice of healthcare and social care. Humanizing and therapy by identifying with the patient personal care experience are interpersonal relation between the healthcare practitioner and patients. Thus, a patient-physician relationship exists when a physician serves a patient medical needs. Generally, the relationship is entered into by mutual consent between the physician and patient. Potential sources of power. Power can form a significant role in the healthcare practitioner and patient relationship. So let's take a look for the potential sources of power for the healthcare practitioner. The first one is knowledge of expertise, which is education and experience. The second one is language, which is medical terminology. The third one is environment, which is delivery of care or therapy within the environment of a healthcare organization. The fourth one is uniform that can represent status. As we can see through the uniform, we can know the position of a person such as doctor, nurses or medical assistant. So through the uniform, we can see the differences of the status. So the last one is professional autonomy as a gatekeeper to treatment or care or therapy. Next, potential sources of power for the patient. The first one is knowledge and expertise, which are IT, internet, or impact of their illness on their every experience, because every patient has their own experience. The second one is environment, which is care or therapy or treatment delivered within the patient's own home, so that patient can receive treatment at home according to the suitable in of the condition of a disease. The last one is right, which are right to complain. The patient has the right to complain about any dissatisfaction with the services performed by the hospital or the health practitioner itself. The second one is right to ask for a second opinion. The patient has the right to seek a second opinion from the medical practitioner involved, whether on the decision to perform the surgery or otherwise. The last one is right to refuse treatment. So the patient has the right to refuse the treatment if they don't want to. Let's move to the other topic, which is healthcare choices. There are three categories of healthcare choices, which are choices governed nationally, local choice availability, and the last one is other preferred choices. Okay, next, compliant versus non-compliant. It has been estimated that only about 50% of patients with the chronic diseases living in developed countries follow the treatment recommendation. The clinical guideline makes recommendations regarding how healthcare professionals can help patients to make informed decisions by facilitating patient involvement in the decision to prescribe, together with how they can support patients to adhere to the medication or prescribe. The next one is recommended approach. A no-blame approach encouraging patients to discuss non-adherent and any doubt or concern they have about their treatment. A patient-centered approach that encourages informed adherence and identification of a specific individual perceptual and practical barriers to adherence. Next, concordant related to the medicine taking is a more contemporary approach to prescribing that involves shared decision-making between the patient and healthcare professional, with the concordance being the outcome of the process. Concordance is an example of the promotion of partnership between the patient and the healthcare professional. The last one is Stockwell study explore the interpersonal relationship between the nurses and patient in general hospital wards, and identified that the least popular patients identified by the nurses fell into two broad categories. The first one is those who grumble and complain or demanded attention in other ways, and others whom the nurses considered did not to be in hospital or on a particular ward. Let's move forward. Okay, now we will learn about the type of behavior. The first one is authoritarian approach. The practitioner assumes a more powerful position and educates the patient about the care, intervention, treatment, and outcomes. The second one is democratic approach. The practitioner takes more patient-centered approach to ascertain individual preferences and empower patients. Next, what is patient satisfaction? Patient satisfaction is defined as the degree to which the individual regards the healthcare service or product or the manner in which it is delivered by the provider are useful, effective, or beneficial. The next one is how it is affected by the practitioner-patient relationship. There are 4 elements of the doctor-patient relationship impact patient satisfaction. The first one is trust, knowledge, regard, and last one is loyalty. So what is the structure of the doctor-patient relationship? The first one is active-passive model. It is based on the physician acting upon the patient who is treated as an inanimate object. And the second one is guidance cooperation model. A doctor is placed in a position of power due to having the medical knowledge that the patient lacks. So the last one is mutual participation model. It's based on an equal partnership between the doctor and the patient. Next, 3 key traits of a positive patient-provider relationship. There are 3 key traits of a positive patient-provider relationship, which are express clinician empathy, practice strong communication skill, and the last one is drive shared decision making. Let's move now to the last topic, which is factor influencing the physician-patient relationships. The first one is dynamic between the physician and patient. Refers to the communication patterns and the extent to which decision-making is shared between the both parties. The second one is trust between physician and patient. Patient must be able to trust doctor with their life and health, and that maintaining trust in one care guidance for physician. Last but not least, here I can conclude that the relationship between a patient and a physician is based on trust, which gives a rise to physician ethical responsibility and to place patient welfare above the physician's own self-interest or obligation to others. Here is a great quote that I can share from Nelson Mandela. And thank you for watching and have a nice day.